Hey, it's Dr. Amanda with StraightSmile Solutions, StraightSmileSolutions.com, and today we're going to talk a little bit more about having existing periodontal disease and getting braces or Invisalign or clear aligners. And I have a more detailed blog that's written more towards the dentists that are out there. You can access the blog by going to my website, StraightSmileSolutions.com, and click on About Us, then click on Blog. And in there, we're going to go over the points more in detail. This is written again more for doctors, and I'm going to be talking about this today at a high level. For patients that often have this question, it's best that you talk to your particular dentist, your general dentist, or your periodontist to ask this question, as well as your orthodontist. Your dentist might be the same as your orthodontist. Not all dentists are orthodontists, but all orthodontists are dentists. But you need to get all the people that are involved in the care of your teeth involved in the care of making this decision. It's not a decision that I can make for you. Okay, so my answer, basically high level, is yes, some periodontal patients can indeed get orthodontic treatment, but it isn't without risk. My preference is for these patients always to be in the slowest, lowest type of movement system, which for the most part out there is Invisalign, although there are some other aligner systems that can be tweaked to be slow and low forces. That would not be ClearCorrect. That is the last aligner system I recommend because their trim level is too high. So it needs to be an aligner system that has a scalloped trim line now, and that also has slow and low forces. So now you can take any aligner company or any aligner system and you can slow down the forces, but that's not how the default comes. So the doctor needs to know how to drive the bus on this. And for the doctors that are out there, if you don't know how to do that, that's something we'll be glad to help you do. Also, and why? Okay, so let's go back to braces. Absolutely, periodontal patients, I don't think should get braces. Hands down, that's a no. 20 years ago, there really was no choice. So we used to say no to most patients who had periodontal disease, severe, moderate, Now we can take more patients because with braces, and I've got more content made on this, you can just put in not Google, but go to my YouTube, put in periodontal disease within my StraightSmile Solutions YouTube, and more videos will come up. We talk more about periodontal disease, and the difference between braces and aligners and how that works. Braces, you're going to come in, you're going to be using heavier forces just as a default because it's wires, and you're going to have your tightening, quote unquote, every 6 to 10 weeks. So it's a high force tightening. Patients feel that after they get their braces tightened, it's like ouch for 2 or 3 days, and then the forces slowly dissipate over time until you get the new tightening again. So it's a bit of a sinus curve in terms of forces. We don't want that. That's actually and that's fine for kids, but that's not fine for periodontal patients. So the thing I like about Invisalign or subaligner companies, like I said, not ClearCorrect, those that have the full scallop trim, this is where full scallop trim comes into effect, is that the forces, normally these are made to change. We want ones that have 7-day changes or 4-day changes or 3-day changes, not 2-week changes, because we want the forces to be as slow and as low as possible. So it's literally just a slow, low, consistent force. The less undulation we can have in the forces, the better for the periodontal patient. So that leads to less tissue breakdown over time during treatment and less inflammation. Also, we need to put our periodontal hat on and differentiate between active periodontal disease and past or historical periodontal disease. People can have periodontal disease that happened previously in their life, but it's been totally resolved. It doesn't mean the tissue breakdown might still be there. They might still have some recession, but there's no active disease going on, no inflammation, no bacteria, anything like that. That's okay, as long as it's not so much breakdown that the teeth are not supported, okay? So, hey, even I don't know if I had periodontal disease or it's just getting old, but I have a few millimeters of recession and a little bit of bone loss. As far as I know, my hygiene's always been perfect, but I'm old. So, these things happen. Who knows, maybe, I don't know. But I definitely, if you diagnosed me, it will say I had mild periodontal disease, but I can have ortho. That's totally fine because it's not active and it's only mild, a little bit, right? Now, look at this patient here. This patient here has severe periodontal breakdown on many of the teeth. I don't know if this is active or passive, They might go in and probe, and there might be 2 to 3 millimeters pockets everywhere and no BOPs. Well, but this patient, if we try to put aligners on them, these teeth are probably going to fall out. You have to think about, just like a tree in some soil, if you don't have enough soil for the tree, it's going to flop over. If you try to, if there's a windstorm, it's going to fall over, right? So same thing with moving teeth. You need to have enough support. So that might mean the patient needs to go to the periodontist and have some surgeries, get some more bone, things like that. But I always recommend that unless you are a periodontist, you shouldn't be making this decision. If you have that kind of gut feeling that, I don't know if this is enough bone, I don't know if this is too much recession, attachment loss, you need to send your patient to the periodontist. Always let the periodontist make the call on that. You are not a periodontist. You're a general dentist, okay? So you know something about periodont and you can do periodontal treatment. But now you are mixing three things. You are mixing two specialties that you're not, orthodontics and periodontics, and you're trying to make a decision. And in my experience, and I've seen this happen, I've had patients come to me for second opinions. I've had, people consult with me. If you're not sure, let the periodontist make the decision. That is their specialty. And I'm going to always recommend that in writing. And if the patient doesn't want to go to the periodontist to make that decision, then it's not the right patient for you. Refer that patient to ortho and let them deal with it. Because you can get yourself as a dentist in a bunch of trouble by taking a periodontal patient who is not cleared for treatment. Okay? So that's what I do. That's what I recommend you do. Get it in writing. Let them, quote unquote, babysit your patient. It's not babysitting, but let them manage your patient during orthodontal treatment. They come in for their PMTs. I know you're afraid that your patients are going to get stolen later for their hygiene visits. And ultimately, that's up to your patient because they might like going to the periodontist for their hygiene visits. You can't force them to come back to you, Obviously, a classy periodontist will recommend the patient goes back to you if that's what you're requesting, but you can't force that, right? So in any case, that's how I recommend managing perio patients with their aligner treatment. And if you want help on a case or a periodontal case, you're welcome to schedule an appointment with us by going to straightsmilesolutions.com/services. We have one-time appointments where we can help you with your patient. But again, if your patient just had SRPs, that's not solving periodontal disease necessarily. You have to do that 1-month evaluation and show that the inflammation and the state of disease is improved. You have to document it because what's going to happen if you started that case and something went south, okay, and you didn't do that 1-month eval to show that you're managing it and your PMTs to show that you're managing it, just doing an SRP is not solving the problem. Of course, you're not proving that it's been solved, okay? So make sure you're putting your dental school hat back on and doing things properly during orthodontic treatment. All right, thanks so much.